social prescribing it's a pathway to try and bridge the gap between healthcare and community. So traditionally, healthcare runs very siloed and community runs very siloed, and there's this window in between that is kind of untouched. And so social prescribing is a way using sort of traditional language that physicians are used to, where they can make a prescription to someone for community-based resources. So if you think about the social determinants of health, transportation and housing and food security, those aren't things that can be treated by a traditional prescription that a physician might make, but they can all be supported in community through those community-based services. So it's a formal pathway that allows a physician to make a prescription to community.
Social prescribing is really important to me as a physician because I know when I see patients in my office, things that are happening in their lives, the context in which they find themselves really affect their health. And especially as patients get older and they're starting to encounter things like mobility, maybe loss of income, housing, those issues don't often come up in our conversation. And I'm so grateful that I can send my patients when I'm concerned that the person is at risk to the community connector, because I know that they'll have a really fulsome discussion about what's going on in their personal lives and what social issues might be impacting their health.
So in the classic model of social prescribing, the role of the community connector was to take a referral from a GP or other member of the health sector, and that referral would be based on the model of a social prescription, something outside of a pharmaceutical or drugs from the drugstore, for example, and more like an exercise class at a local community center. And at the same time, they would sit down with this individual and co-develop a plan of action so that the senior can himself or herself go ahead and do other things to enhance their strength, their physical strength, and so on, outside of the exercise class.
It is very important to have a formal referral pathway for social prescribing and a standardized pathway, particularly so that everyone and all the players in, I guess, that pathway knows their roles and knows what to do to prevent miscommunication between each other.
Yeah, so social prescribing is, a program that really connects sort of healthcare and social interventions, and the connectors are a vital piece of that. There are resource experts, and so it's very, very important to build that relationship and foster that relationship with the connectors and with our clinicians and our staff. And so I think when we take a more holistic approach, that benefits the client.
So through social prescribing, I think it's a method that brings people together to talk about, okay, this is my understanding from healthcare, this is my understanding from community, what can we do together to support instead of working separately and have a lot of duplication.
We had the opportunity to bring together a number of individuals who were very interested in social prescribing. So some of which were our funded agencies that were already doing this work. Others were people from municipalities and academia and other communities who were thinking, like, how can I do this in my community?
Yeah, I was having, a lot of doubts about the future. I was wondering about where I was going to live, how I was going to exist over the next few years, because I just also recently retired. And so there was the retirement and the pandemic, and I was feeling very awkward. And when I first met Janice, I felt, after our first meeting, I felt a weight off my shoulders, because I could tell that she had the information that I was looking for, and also that I wasn't alone. Other people were having similar issues. I felt I was being heard, I guess is what I'm trying to say.
Having that one-on-one support to, it's like partly it's about the person, the community connector knowing what is available, but the other part of it is just having the support to access those services.
I think it's really important. I hope that a lot of people can benefit from social prescribing. It's a big need, I think, I feel fortunate for having found out about this place.
And so we did a 3-year demonstration project where we funded 20 programs across BC. And they were successful. And so what that means for us now is we are working with the ministry to roll out and expand social prescribing over the next 2 years, and are hopeful that we'll go from 20 programs to 60 in 24-25 and over 100 social prescribing programs in the year 25-26. So by the end of the 2026, we're hopeful to have over 100 social prescribing programs and community connectors embedded all across BC.